Hey everybody, my name is Joshua Hancock. I'm with Orthopaedic and Spine Center Physical Therapy. I'm a physical therapist assistant, and today we're going to be talking about glutes and how they play an important role in our posture and our back health. So the glute muscles are the big muscles in the back that are responsible for a lot of the power that we have in our body. They tie the lower body and the upper body together at the hips, and they're very important for back strength because they do a lot for our posture. The muscles in the back, the glutes, actually bring our pelvis backwards into alignment and balance out with the hip flexors in the front. A lot of times we spend a lot of time sitting down, so the hip flexor muscles in the front are in a shortened position and the glutes in the back are in a lengthened position, so that causes a muscular imbalance and an underactivity of the glutes in the back. A lot of the symptoms that I see with a lot of my back patients are underactive glutes. So what we want to do is try to activate those glutes to help maintain that posture and support the back. One of the ways that we test to see if the glutes are active is we actually just palpate the glutes and have the patient lift their leg straight up and down. So what I'll do is I'll just push into here and have Audrey lift up and down. What we're looking for is these hamstrings tightening before we feel anything in the glutes going on here. Now Audrey's healthy, so she's got everything working in the proper way, but a lot of times we won't feel that firing. So what we can do is we can actually have the patient do that a few times, and we'll add a little bit deeper pressure to activate those glutes more to elicit that firing sequence. What we're trying to get is those glutes to fire almost before you get the lower extremities to fire. Okay, so now we're going to go over a few basic strengthening activities that a lot of people can do to strengthen their glutes. Alright, so this is a simple exercise that's going to involve both of the glutes. This is a very simple exercise that almost anyone can do. So what Audrey's going to do is she's going to activate her glutes, squeezing her glute muscles first and then pushing her hips up off the mat and down. Now you can hold this for a count 3 to 5 seconds. So go up and back down. And it's very important that you squeeze those glutes first. Once again, we're trying to get that firing of the glutes and the activity before the motion occurs. Alright, another set of important glute muscles is called the glute medius and minimus. They're actually connected here from the wing of the pelvis down to this part of the leg. And they do a lot for the hip. They actually move the leg out, they help to move it forward, they help to rotate it, and they help to move it back as well. An interesting thing about these muscles on the side here, they play a very important role to help elevate and depress the pelvis when we walk. And when we walk, we're taking force from the ground and translating it through our legs into our body. Now, if these glutes are not firing properly, they're not able to take that pressure from the ground, and that pressure actually gets translated into the spine, which can lead to a lot of different things there that could, give you pain or go wrong. So one of the exercises that we do for the glute med is something called a fire hydrant, and that involves lifting the leg out to the side and back down to activate those glutes on the side there. It's a very good exercise. And finally, another good glute activation exercise that you can do at home is something called donkey kicks. And what that involves is extending that leg back with the knee bent, pushing that heel up straight towards the ceiling and back down. What that does is that gets a good contraction of all the glute muscles in the back. If you find that to be too easy for you, you can kick it straight back out, which actually causes the glutes to take on more of a weight to activate them more completely. So back pain could be alleviated by something as simple as strengthening underactive glutes. A good way to figure out if that's something that is going on with you, you can come into Orthopaedic and Spine Center Physical Therapy, and we can assess you and see if that's something that would be viable for you.